Let's take this across to the experts on our show today. Dr. Padmanabha Shenoy, rheumatologist and immunologist in Kochi, joining us on the show. Also, Dr. Rajeev Jayadevan, Vice Chairman, Research Cell, IMA. He's also a member of the National IMA Task Force on Coronavirus. Thank you both very much. Dr. Shenoy, Dr. Jayadevan, let me begin by asking you, we've heard two very different accounts just now. The fact that all these breakthrough infections, 87,000 recorded nationally, and we're talking about people who've had 2 vaccine doses, 40,000 of them from Kerala alone. Kerala says this isn't something to worry about because these infections have all been mild. The numbers are high because of the kind of contact tracing they're doing. Your thoughts?
Okay. First, for our viewers, let me translate what these things mean so that they can follow the discussion. Imagine that the COVID vaccine is being put through an examination that has 2 subjects, mathematics and English. It scores 100% in math, but gets just pass grade in English. Now, what I mean here is vaccines are scoring high marks when it comes to preventing severe infection and death all over the world, but they are not doing very well or just scraping through the pass grade when it comes to preventing the virus from entering the body, that is, in the nose and throat. Severe disease is caused by lung COVID, and nose COVID is a milder form. I hope you see the difference. So vaccines are not very good at stopping the virus from getting into your nose, and that is a well-known fact. And we are seeing that on the ground in Kerala. We saw that earlier from the publications from major institutions like CNC Vellore and so on, that about 10% of healthcare workers got infected by the month of May during the Delta surge. And why is that? In spite of 2 doses of vaccination. It's simply because of greater exposure to the virus, but they were not getting sick. None of them got sick. None of them required oxygen or ICU support.
Right.
So back to your question. So what we see here, as any population in the world gets vaccinated, the percentage of people who are vaccinated will increase. And along with that, since the number of people who are vaccinated will also increase, the number of people who get breakthrough infections also will increase. I believe that is what Dr. Anish had mentioned.
Right.
But by the time you translate it for the viewers, these percentages and absolute numbers can be a little confusing. So let me take you through a hypothetical example. Imagine a town with 100% vaccination coverage, and about 10 people get breakthrough infections, mild common cold infections, and the town's contact testing is so good that they pick up all 10. Now, when they look at all 10 had received vaccine. So the breakthrough infection rate, if you look at the total numbers, 100%. You can say 100% of people who got infected in that town were vaccinated. So someone who hears this 100% will think, wow, vaccines are failing. No, that is not true. That is the difference between percentages and absolute numbers.
So, Dr. Shenoy, then is it important to see how many of these are severe cases which actually need hospitalizations and interventions before any kind of alarm is raised over this? I mean, after all, we do have sources at the Union Health Ministry saying they're concerned about these numbers. Where is this concern coming from then? And, what should it mean in terms of epidemiological interventions? Are they needed?
Yes, I think what is most importantly we should understand is that vaccines, as Dr. Rajeev said, are not doing very well in preventing infections. We have seen in US, we have seen in UK, we have seen in Iceland. In these waves, although the cases are going up, let us take the example of UK. When the cases are post-vaccination, they have vaccinated 60-70% of their population. The cases are surging. Cases are surging to 30, 35,000, 40,000. During the previous wave, when there were 35,000, 40,000 cases, around 700 to 800 deaths used to happen. Hospital beds used to close 10,000. But now the hospitalization has remarkably come down. Deaths have come down by 1/5 or 1/7 or 1/10. So it indicates that this is the same trend is in US vaccinated states also. So in Kerala also what is happening is the cases are going up, but the hospital occupancy is not increasing. It is staying around some 2,000, 3,000 beds. That's all. So we should not be overly worried. But yes, if there is a data saying that out of 40,000 people, how many got admitted in hospital? For example, 10 or 15% required hospital admission, then that is a cause of worry. But that data is not there in public domain, one. But whatever general public data, available data shows that there is no severe rapid increase in hospital admission rates or ICU or ventilated admission rates. So nothing to get concerned overtly, but yes, we need to keep a vigil.
So, Dr. Jayadevan, help us understand who is most at risk. Are there sections of the population who are more vulnerable for breakthrough infections, or is this something that could actually happen to anybody, including those who are fit and double vaccinated?
That's an excellent question. If you looked at the Qatar study that has just been published comparing Pfizer and Moderna, they made this observation. Breakthrough infections are more likely to occur in someone with greater exposure to the virus. So if your behavior is careless, if you go out in the community, if you go partying, or if you meet a lot of people, or by virtue of your work, you have to meet a lot of people who might be COVID positive, yes, you could pick up an infection. But on the other hand, if you wear a mask all the time, minimize your social interaction, reduce your social bubble, you don't interact with too many social bubbles, yes, the risk of picking up the virus is lower. So that is fact number one. The second aspect of the answer to your question is, are any of these people more likely to become sick? Yes. As you know, for COVID-19, there is a strong age-related gradient, which means that if you take a 75-year-old person with COVID-19 and a 25-year-old person with COVID-19, the 75-year-old person is 200 times more likely to die. I'm very sorry, that is the fact, which means that the older people are at greater risk for COVID-19. And the same gradient to some extent occurs even after vaccination. Yes, the total numbers, the total chance of getting COVID-19 or getting sick is drastically reduced, but among the people who are fully vaccinated, the older people still are the most vulnerable. And then there are people who are immunosuppressed, transplant recipients. Dr. Shenoy is one of the finest immunologists in the country. So he will talk to you more about the immunology aspect of it. Basically, if you are a transplant recipient, your immune system has to be down for the organ to function. Yes, you may have a slightly increased risk of getting complications should you get a breakthrough infection.
So, Dr. Shenoy, especially in the case of immunocompromised patients or those who are elderly, should India then at least be considering booster doses for those who are most vulnerable, given that these breakthrough infections seem to be rising?
See, I think booster doses, like Dr. Rajeev always keeps telling, is third dose. It is not a booster dose.
All right, fair enough. A third dose of the same vaccine. Yes.
Basically, what we should think is in immunosuppressed. I think immunosuppressed definitely it has a role. For example, those who are taking anti-immunomodulators, immunosuppressant drugs like transplant recipients, those who are on autoimmune diseases like methotrexate, there are a lot of drugs which suppress the immune system to a great extent. Those patients do not adequately respond to the vaccine, which like 2 doses. Some of them require a third dose because of 2 reasons. One, they don't adequately respond to the immune system and produce enough antibodies and T-cell response. And secondly, more importantly, once they get a disease, they are likely to get sick. Because of these 2 reasons, those people who are on immunosuppressed may require a booster dose. Elderly, the jury is still out. I think it is more important for India to at least give vaccines to maximum number of people. But immunosuppressed patients, I think they may require a third jab.
But Dr. Jayadevan, do you see that happening? Is that something that's likely to be taken on board, given India is still falling short of its vaccination target? Do you think a third dose of vaccines for the most vulnerable would be a probability anytime soon?
Well, as Dr. Shenoy said, the third dose, we do not know if giving a third dose will make it any safer for these individuals, regardless whether they are older, immunosuppressed, or in otherwise good health. It is a guess. So sometimes in medicine, you take an educated guess because you don't know the outcome, because there is no way for you to determine the outcome and there is no data for you to go by. You take the best available guess. So as Dr. Shenoy said, if these people are at especially higher risk, there's nothing wrong in going the extra mile and giving them an extra dose. And see, I don't see a dire emergency or dire need to rush and vaccinate everybody in that segment with a third dose. We will get plenty of published information in the next 6 months or so to see how these people are doing. But meanwhile, as you rightly said, it's more important to give everybody a life jacket. Quoting Michael Ryan from WHO, he's given a viral quote. First, give everybody a life jacket, and
Yes.
then think of giving somebody 2 life jackets to
That's
save people from drowning. I
That's
think
a
that's more important.
wonderful analogy, Dr. Jayadevan and Dr. Shenoy. Thank you both so much for being on the program.